Good afternoon. Thank you for joining us for today's Lead Center webinar, WIOA and the Unified State Planning Process. Today's webinar is part 2 of a 4-part series on WIOA. Today's speakers are Michael Morris, who's going to be a presenter and moderator. Michael is the co-chair of the policy team for the Lead Center and the executive director of National Disability Institute. We'll also be hearing from Kim Vitelli, Chief, Division of National Programs, Employment and Training Administration with the U.S. Department of Labor, Heather Fleck, Team Lead for Governance and State Planning, Office of Workforce Investment, Employment and Training Administration with the U.S. Department of Labor, Andrew Reese, Deputy Director, Rehabilitation Services Administration, District of Columbia, Department on Disability Services, Andrew Rogers, Associate Director, DC Workforce Investment Council, Deborah Carroll, Director of DC Department of Employment Services, and Paulette Francois, Deputy Director of Workforce, DC Department of Employment Services. For those of you who are new to the Lead Center, the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, or LEAD Center as we call it, is a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy. I'd now like to invite my colleague, Nakia Matthews, to offer a few housekeeping tips.
Thank you, Elizabeth, and good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see an image of here. And if you accidentally close this panel or if the sound stops, you can reopen it by going to the Communicate menu at the top of your screen and choosing Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, you can dial the toll or toll-free number that you see here and enter the meeting code. Please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you'd like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A, and conversely, if you do not need the captions, you can minimize the Media Viewer panel. There will be time for questions at the end of the webinar. Please use the chat box or the Q&A box to send any questions you may have during the webinar to me, Nakia Matthews, or Elizabeth Jennings, and we will direct those questions accordingly during the Q&A portion. If you are listening to the webinar by phone and not logged into the web portion, you may also ask questions by emailing them directly to Elizabeth at ejennings@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the Lead Center website. If you experience any technical difficulties during the webinar, please use the chat box to send me a message, or you may also email me directly at nmatthews@ndi-inc.org. And now I'd like to turn it over to our friends at ODEP to give us a welcome.
Thanks, Nakia. This is Chris Button from the Office of Disability Employment Policy. I want to thank our lead colleagues and team for organizing this exciting webinar today, and a welcome to everyone from across the country who is listening in, and of course, a big welcome of appreciation to our federal partners, Kim Vitelli and Heather Fleck, senior leadership here at the Department of Labor's Employment and Training Administration, for joining us, as well as our panelists and leaders from the District of Columbia. I think that in combination, we're going to have a really interesting and exciting conversation about a very, very important part of the WIOA, the Unified State Plan. It's a particularly exciting time for people with disabilities because the reauthorized law includes so much of a presence of disability in terms of language that has been sprinkled throughout the reauthorized law. And the component of the law that we're talking about today, the Unified Plan, is particularly important because for people with disabilities to be securing competitive integrated employment, partnerships and collaboration and coordination across multiple WIOA partners is really essential to making that happen. And I think we're starting that conversation today by learning a little bit more both from ETA about where they are in the rollout process of governing provisions for the new law, and also in hearing some thoughts from our speakers from the District of Columbia. So I don't want to take up additional time. Thanks to everyone for being here today, and we really look forward to hearing this webinar.
Thank you so much, Chris. Today's webinar falls in line with the LEAD Center mission, which is to advance sustainable individual and systems level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disability. You can learn more about the LEAD Center at www.leadcenter.org. Today, we're going to review the webinar outcomes. We're going to look at an overview of the unified state planning process. We're going to take a look at a collective impact framework and harnessing the power of collaboration to meet the goals that Chris pointed to. We're going to have a discussion with the District of Columbia collaborators, and we're going to try to leave ample time for questions and answers. So as noted earlier, please do submit your questions as they come up, and we'll vet them with the speakers before today is done. After today, we believe that you'll have a better understanding of the core elements of the Unified State Plan, opportunities for cross-system collaboration in the development of the plan, specific provisions to improve access to and participation of youth and adults with disabilities in both state and local workforce development services and supports, timelines and the approval process for state plans with review by USDOL and USDOE, and opportunities for participation among multiple stakeholders from the disability community. I'd now like to invite Michael Morris to join us and take it away, Michael. Thank you.
Thank you. Thank you, Elizabeth. Thank you, Chris Button. This is really an extraordinary opportunity to hear from presenters at both a federal level and then a conversation with people working within DC government. So without taking any further time, I want to first turn to my colleagues from the Employment and Training Administration for their presentation on the overview of the Unified State Planning process. The two presenters are Kim Vitelli, Chief, Division of National Programs, Employment and Training Administration, U.S. Department of Labor, and Heather Fleck, Team Lead, Governance and State Planning, also Office of Workforce Investment, Employment and Training Administration, U.S. Department of Labor. Thank you, Kim and Heather, and let me turn the floor over to you.
Thanks, Michael. Good to be with all of you today. Let me just start off with an overview of the introduction to the Workforce Innovation and Opportunity Act. And I think that we're still working out some of the technical issues on our side, so I'm going to ask if someone at LEAD can advance the slides, if that's okay. The Workforce Innovation and Opportunity Act was signed into law on July 22nd, 2014, a day that will live in infamy. The proposed rules to implement WIOA were recently published jointly by the Departments of Education and Labor just this month in April, and they're available at regulations.gov. We're going to give you some more details about the regulation in a few slides. Some really important features, though, of of the legislation is that job seekers with and without disabilities can receive and benefit from job search and placement assistance, career counseling, skills training, and other supportive services. Those are features woven throughout multiple programs, including the Title I Adult Dislocated Worker and Youth Program, the Title II Adult Education Program, the Title III Wagner-Peyser Employment Services, and of course Title IV Vocational Rehabilitation. Now, the new law is going to start to take effect pretty shortly on July 1st, 2015, although for vocational rehabilitation, the amendments for the Rehab Act took effect immediately upon passage. So those amendments took effect on July 22nd, 2014. Let's move to the next slide. There's several key pieces of WIOA, several important key changes. One is a really strong emphasis on career pathways and sector partnerships to promote employment in in-demand industries and occupations. Of course, it eliminates the sequence of services before enrollment and training. Previously, some people interpreted the law to mean that you had to pass through core and intensive training before accessing, you had to pass through core and intensive before accessing training. That's definitely no longer the case. The law is very specific that people can access any type of services that they need at any point that it's determined that they need them. The law, importantly, also establishes a single unified strategic plan, and that's really mainly what we're going to talk about today. In that plan, there's a couple of key features. One is that strategies for all workers need to be discussed in the local and state plan, and strategies for individuals with disabilities are part of that overall strategy and have to be broken out. Performance outcomes must be identified and reported for all of our programs. There's a set of common performance measures that are now common across Department of Labor and Department of Education programs. And like our current performance reporting system, we collect demographic characteristics on all participants in all of our programs, and that includes disability. The law also establishes criteria for certifying American Job Centers, and that have to be renewed every 2 years. That includes assessing the physical and programmatic accessibility of the facilities, of the programs, everything, as well as continuous improvement in their services and effectiveness. So let's talk a little bit more about the proposed rule. So I'm gonna pause a moment and ask let's move forward one more slide. There we go. So the Department of Labor and Department of Education jointly published a proposed rule, a notice of proposed rulemaking on April 16th for 60 days public comment. So you have until June 15th in order to make public comments. There's 5 parts of the rule. One is a joint rule that covers all of the education and labor programs. That joint rule covers things like one-stop operations, workforce boards, and planning and performance. There's a rule that just covers the Department of Labor programs, and then there's rules that specifically cover the adult ed program, as well as, I believe, 2 rules for the vocational rehabilitation programs. So unified and combined plans are found in the joint NPRM. All comments, anyone that wants to make a comment on any part of the regulation, whether they love it, feel neutral about it, want to see it changed, all of those type of comments need to be submitted on www.regulations.gov. You should know that anytime you make a comment on the rule that your name will be attached to that. You can't submit anonymous comments to a rule. Any comments that people make today in the chat feature would not be considered comments on the rule. The only way to submit comments on the regulation would be to enter them into the website at www.regulations.gov. It's our role as the Department of Education and Labor to read and review all of the public comments, address them, and make any necessary changes to publish a final rule, and that final rule will be published in 2016. You might wonder what workforce programs should be doing in the meantime while the rule is being considered and open for public comment. We are all living within the statute right now. The Department of Labor has also issued several pieces of guidance to explain, and it will continue to issue guidance in a series to explain how to operate programs while the rule is being finalized. One of the things that the department will be issuing guidance on is the state plans, and I'm going to turn it over to Heather to talk more specifically about the planning provisions.
Great. Thank you, Kim. And as Kim mentioned, the state planning pieces are in the joint rule that we wrote with the Department of Education. And just to clarify something Kim said, the section on state boards and local boards is in the Department of Labor only rule. So if you're looking for that, that's where you should look. But the state planning pieces themselves, you can find them in sections 102 and 103 of the Workforce Innovation and Opportunity Act. And the governors have to submit a state plan by law to the Secretary of Labor, even though it's a joint plan with other programs, and it has to outline a 4-year strategy for the state's workforce development system. And states have to submit this plan in order to receive their funding for all of the 6 core programs that are in WIOA. The plan supports 2 of the key reform principles of the WIOA, better alignment and integration. The Opportunity Act reforms state plan requirements so that it can foster better alignment of federal investments in job training to integrate service delivery across the programs and to improve efficiency in that service delivery, and also to ensure that the workforce system is job-driven and matches employers with skilled individuals. And I'm sorry, can you advance the slide? Thank you. And then secondly, the second reform principle that state plans support are really planning across programs. WIOA wants to see that states do plan across the programs and that this joint planning is part of the unified and combined state plans, just to promote a shared understanding of the workforce needs within the state and to come up with a comprehensive strategy for addressing the needs within a state. Next slide, please. So as we've said, so the major reform in WIA is that a single unified plan at minimum is required, and this has to cover the 6 core programs. If you don't know, those are all the Title I programs administered by the Department of Labor, which are adult dislocated worker and youth, and the Title III program, which is the Wagner-Peyser Act, and then 2 Department of Education programs, which is the Title II Adult Education and Literacy, and Title IV, which is the Vocational Rehabilitation program. So that is the minimum number of programs that states must include in their unified state plan. But states also, next slide, please. States also have an option to submit what is called a combined state plan, and that you can think of that as a unified plan plus. So it can be all the core programs and it can be put in a combined plan plus a number of other workforce-oriented programs where the state wants to develop a coordinated strategy across more programs. So there's a lot of those optional programs available to include in a combined state plan. Career Tech Ed programs authorized under Perkins, the temporary assistance for needy families, employment and training programs under the Supplemental Nutrition Assistance programs. There are other programs that are administered by Department of Agriculture that could be considered. There are a number of programs that the Department of Labor administers that could also be included in a combined plan, such as the Trade Adjustment Assistance Program, Jobs for Veterans State Grants programs, Unemployment Insurance programs, the Senior Community Service and Employment Program, and then within HUD has some employment and training activities that the state may consider including in their comprehensive combined state plan, as well as from HHS, the Community Services Block Grant, and then, again, Department of Labor Reintegration of Ex-Offenders. So that is a lot of choices of programs to be thinking about within states about how to better align resources, how to plan and integrate across multiple funding streams where it makes sense to align resources. And then Kim here actually does oversee the Senior Community Service Employment Program and might have some perspective of how to bring that into a combined state plan.
Sure. And, you know, the department actually a few years ago issued guidance to our states to encourage and allow for states to more easily submit a state plan that included both the, at the time, WIA Title I programs as well as other DOL employment and training programs like CSEP. And I think nearly half of the states took us up on our offer. And so a lot of states already have some experience in integrating their plans for CSEP with the Title I programs. And so it would be a natural fit if those states wanted to continue to do that under the combined state plan. And of course, we would encourage any state that wants to do so as well, in addition to states that already have experience with that. A lot of states in their previous experience combining CSEP and Title I programs found that it gave them a chance to just in one place talk about how they were serving older Americans and how they were serving an older workforce, because there's more than one program that serves older workers, and this gave them a chance to talk about it in an integrated way instead of having to silo out different strategies with different funding sources and submit different documentation. So it was something that a lot of states seized the last time, and we look forward to seeing if it'll be the same kind of welcome opportunity in this next round of planning.
Thank you, Kim. Next slide, please. Okay, so just to give you all a sense of the timeline and some things to look out for in the coming months for state planning. So as we've mentioned, the law was enacted last July, and the law itself has a very detailed explanation of planning requirements. Now, those are like more minimal planning requirements, and we will become more expansive in future guidance on what those means. But you know, if you're wondering what to include in a plan, what's required, the law does a very good job of spelling out a lot of requirements. So definitely look there for an idea. The Departments of Labor and Education, along with other federal agencies that are affected by the combined state plan, also intend to issue joint planning guidance and joint information collection requirements, which would be part of the Paperwork Reduction Act process. And we're targeting the late fall to release those requirements, but we will be putting the information, the requirements for state planning out for public comment hopefully this spring, so that you all can get a very good idea of kind of what the departments are thinking on the state planning requirements beyond just sort of how the statute spells them out, as well as, you know, the NPRM has a proposal related to state planning. So check out, be aware of that information. States will be required to submit their state plans under WIA by March 3rd, 2016. That's the statutory deadline. And the plan should address 4 years at minimum, covering the 6 core programs. And we expect that those state plans will be in place by June 30th, 2016, in time for the beginning of the program year, which most of the Department of Labor programs run on a program year that starts July 1st. And then the statute also requires that plans be reviewed every 2 years and refreshed for changes in the economy, changes in strategies. There may be a new governor in place that wants to, you know, review its plan and change it. So the WIOA does allow for a 2-year update to the state plan. Next slide, please. So in terms of kind of what the plans are intended to do, they're really intended to describe the state's overall strategy for workforce development and how that strategy is going to meet the needs of both the workforce and employers over the coming years. And then WIOA also allows for or requires a local planning process, and it expects that those local plans are aligned to the strategies in the state plan so that everyone within the state is carrying out and moving toward the same goal. Of course, you know, tailored to more localized needs. Next slide, please. The major content areas of both the unified and combined state plan include strategic section and then operational planning elements. And WIOA separates the strategic and operational plan elements in order to better facilitate cross-program strategic planning, and then to identify operational elements across the programs that would support the system-wide vision. So some of the strategic planning elements in particular include a state analyses of the economic and workforce factors, an assessment of workforce development activities in the state, sort of like a gap analysis of what's going on in the state and the ability of the workforce programs in the state to meet those needs, as well as a formulation of the state's vision and goals for preparing an educated and skilled workforce that can meet employers' needs. And then it asks the state to articulate which strategies it's going to employ to meet its vision and goals. So that's just sort of an overview of the strategic section of the plan. There's a heavy focus and emphasis on the use of economic and labor market information to ensure that the state strategies are in fact based on a really good understanding of the economic opportunities within the state, as well as what the needs of the workforce actually are to be able to enable them to have good job opportunities. So, we're looking at how to best analyze that data and prepare. States should be prepared to understand the economic conditions in order to better formulate its strategies. And I don't know, Kim, if you want to comment on anything related to that.
Sure. I mean, I would just echo that the use of labor and workforce information is a really important foundation for any strategic plan. The labor market information and really past performance information, too, can tell you so much about what's going on in a state, how many people are unemployed, what kinds of education and even work experience that people have in the area, what are the demographic characteristics of the people that you might be likely to serve, and what's going on, how many people have disabilities in the state, how many people have other barriers to employment, like how many people have limited English proficiency, how many people have been relying on public assistance, and also these also are indicators of opportunities as well. The labor market information can give you a picture, too, of what sectors might be slowing down and experiencing layoffs. It gives an indication of where the workforce system and all the different programs might need to target their resources to be able to help people successfully navigate and transition into a new industry. When people aren't able to successfully navigate from one slowing down industry into another, they're more likely to rely on public assistance, including disability benefits. It's not just, though, a picture of what's happening on the worker side, but the labor market information can give us a picture of what's happening on the demand side, what occupations are growing, what occupations and industries have a regularly high demand for workers, what kinds of workers that they're looking for, and the skills associated with that so that we can target training and employment services and education to meet the needs of those businesses so that we can connect workers and job seekers with the jobs that exist in the local area. So the labor market information is really the foundation of all strategic planning.
Thank you. So that's the strategic section of the plan. And then there's a lot of operational planning elements that WIOA is seeking to have addressed in the plan. And really, this is where sort of the nuts and bolts of how states are going to implement their strategic vision and goals. And there are four sort of subsections that WIOA lays out for the operational planning elements. It's state strategy implementation, state operating systems and policies, program-specific requirements, and then assurances. And these are really meant to ensure that the state has the necessary infrastructure, policies, activities in place so that it can successfully align its programs and support the ongoing integrated service delivery. So, some of these things are all about, what are the common policies you're going to put in place? What are your common sort of communication strategies that you can put in place? What are the infrastructure such as performance and assessment going to look like? as well as in terms of program-specific items, you know, even though we want alignment and sort of integration across programs, there are things unique to each funding stream that we are looking to learn about in the state plan. And so there's a section in the plan that does allow for articulation of those very specific and unique attributes of those particular funding streams. And then assurances are just states promising that they're going to do certain things to comply with the law. That's the operational planning section. Also, critically important. A lot of folks think the strategic vision is the most important aspect of the state plan, but it's really, and it is incredibly important, but the operational piece is incredibly important as well, so that everyone in the state can have a good roadmap for how to move forward to implement the strategy. Next slide, please. Thank you. So there's, you know, the Departments of Labor and Education do intend to be doing almost everything jointly as we move through this process. And that while the statute does require that plans be submitted to the Department of Labor, we're putting in place operations to ensure that those plans are immediately available to Department of Education, and then will be jointly across our agencies, and along with any other programs that might be other agencies in the combined state plan. We're coming up with a joint review process as well as a joint approval process for those plans. And that's just to ensure that we're all on the same page, that we can all agree on what's important in terms of alignment and integration, and hopefully glean ourselves on what are some good practices that states are putting in place, and be able to share those more widely with the system. Next slide, please. So you might be wondering what you can do now while you're waiting for further guidance from the departments. Would definitely say look at the law. That has a lot of really helpful information to guide you in terms of what to expect for the legal requirements around state planning. Make sure you're already, you know, at the table with your partners. If that's not happening, that should be happening. At minimum, the 6 core programs should be talking to each other, but also any other partners you think it makes sense, the partners that are required in the one-stop system, any of those combined plan partners that we listed on earlier slides. Just begin talking to each other, learn about each other's programs, learn what the opportunities are, learn where you have common customers, learn what your unique features are. That's all important foundational work to best figuring out how you're going to align and integrate resources for the best effect for your customers in the state. And then, you know, there should be just some sort of nuts and bolts things that you should be thinking about, like what your timeline is, so you can hit the submission deadline. How you just want to approach planning itself, whether it's like having some facilitated conversations, you know, just sort of the process you want to put in place to ensure that you're talking to each other and planning together, as well as, you know, having some sense that, you know, all plans need to be very public and transparent and put out for public comment, so you want to include that in sort of your planning process. And then it is never too soon to be looking at your labor market information, looking at your state's data, gathering it from a number of resources, connecting with your state's labor market information shops. Those are usually housed within the state agencies. You know, that's an ongoing, you know, constant process is looking at and evaluating economic data. So you want to do that now just to get a sense of those foundational elements, which will help you all plan out your strategies. And then, you know, and there's no reason why you can't be thinking now about what the state's vision and overall strategy should be, as well as what you want things to look like at the customer level in terms of ultimately how you want services to be delivered to your customers, both employers and job seekers. Next slide, please. in terms of what some of you on the webinar today might level, I assume. So, you know, these are incredibly important partners in the planning process. So reach out to your state, the state board in terms of, you know, development of the state plan, make your voice heard. There is an expectation in WIOA that local boards be consulted in the development of the state plan, so that's another connection point. And then certainly get involved in the local planning processes as well, because that is critically important to the success of WIOA as we move forward. And just to, next slide, please. And just so you know that we're trying to practice what we preach here at the federal level in terms of working together. We have really taken that to heart. Almost everything, definitely around state planning, we're doing together at an interagency level. So we, since WIOA passed, the Departments of Labor, Education, Health and Human Services, and then for the combined plan partners, the U.S. Department of Agriculture and HUD have been engaged in weekly and sometimes more often than weekly conversations on the activities that we're doing jointly. So planned at things we have already done and things that we do plan to do together with a coordinated voice include the notice of proposed rulemaking and then ultimately the final rule we're doing together, the development of the planning requirements and joint guidance related to state planning. We are looking at how we can have the best mechanism for collecting the plans. So we're exploring the development of an online submission platform that will be jointly owned, as well as jointly sort of looking at technical assistance needs and places where we can coordinate on that. So we're doing a lot of good work together, and we've developed a very solid federal partnership. And then the next slide just lists sort of what the federal partner programs that are engaged in that ongoing work. So, no, we've enjoyed doing that work together, and we look forward to, you know, over the years with WIOA implementation, seeing that partnership grow and hopefully seeing that those partnerships will grow throughout the whole workforce system as well. Finally, there's the next slide lists some resources that you can access. Some of the things we've brought up today, so I won't read through that, but that's available to you if you want to ask questions or look up for other information that's already been released publicly. And I think that is the end of my remarks. And we're back to you, Michael.
Thank you, Heather. And let me pick up from where you left off. What I'm going to do is provide another framework to look at the possibilities of the power of collaboration. What we're going to look at is something called a collective impact framework. Some of you may be familiar with this framework, and others may be less familiar. We're going to look at it within the context that Kim and Heather have shared with you, the approach to the Unified State Plans, as was discussed with the 4 core programs, the Adult Dislocated Worker and Youth Formula Programs, Wagner-Peyser Act, Employment Services, the Adult Education and Literacy Programs, and the Vocational Rehabilitation Programs. We also, as Kim and Heather talked to you, states have a choice to also submit a combined state plan with a lot of other programs across multiple agencies and departments. So let's put this in a context of a collective impact framework. When we take on the issues of cross-system collaboration, We know that it requires new levels of communication, new opportunities for coordination of resources, a lot of things to go on that may be outside what has taken place to date. When we think about collective impact, we're talking about trying to solve complex social problems only by cross-sector coalitions, engaging multiple relevant stakeholders. When we look at the unified or combined state planning process, we realize that there are a lot of stakeholders who could be engaged: employers, the workforce development system, education, vocational rehabilitation, the mental health service delivery system, intellectual and developmental disabilities service delivery system, adult education and literacy, the Social Security Ticket to Work program, nonprofit disability organizations, and people with disabilities. There are 5 conditions of collective impact that I am going to walk us through. The first is a common agenda. The second is shared measurement systems. The third is working together on mutually reinforcing activities. The fourth is the process of continuous communication. And the fifth is backbone support. So let's talk first about a common agenda. As Kim and Heather have shared with you, there's a lot of opportunities here in strategic planning to think about that common vision. Collective impact requires all participants to have a shared vision for change, one that includes a common understanding of the problems and challenges and a joint approach to solving it through agreed upon actions. Organizations often have slightly different definitions of the problem and ultimate goal, and in working together now, sitting together at the same table, there is really the opportunity to look at a common vocabulary, look at common performance goals, look at common strategies in terms of service delivery. Collective impact requires that differences be discussed and you work towards resolution. Shared measurement systems. Agreeing on a common agenda is illusory without agreement on the ways success will be measured and reported. Shared measurement systems enable participants to hold each other accountable and learn from each other's successes and failures. So WIOA gives us a huge head start in terms of a set of performance goals both for adults and youth. So there is a place to look at forming this common agenda and formulating this shared measurement system. Mutually reinforcing activities. Collective impact depends on a diverse group of stakeholders working together, not by requiring that all participants do the same thing, but by encouraging each participant to undertake the specific set of activities at which it excels in a way that supports and is coordinated with the actions of others. We have in play here multiple funding streams, multiple service delivery systems, but as is implied in the name Unified State Plan and State Planning Process, there's an opportunity to identify and tap into these multiple systems, multiple sets of resources, and look at how they reinforce each other when we bring this down to the level or common denominator, serving one individual at a time. Continuous communication. Participants may need regular meetings to build enough experience with each other. It's all about building trust, which comes only from working together, communicating together, sharing that common agenda, identifying those mutually reinforcing activities. Clearly, what's called for, not only in this planning process, but what will follow, is multiple service delivery systems really looking at new ways to work together, looking at best possible solutions and not favoring one organization over another, but how do we blend and braid resources to achieve those common performance goals. The process of creating a common vocabulary takes time, but here clearly within the framework of the American Job Centers and the Workforce Development System, with this unified plan development, there's an opportunity to better understand each other and work at how do we bring these resources into play, one person at a time, job seekers with and without disabilities. And finally, the backbone support. To make all these pieces come together, there needs to be leadership within each of these systems, but a group that really takes this on and has ownership of it, investment in bringing the multiple systems together, facilitating both the technology and communication support, working on sharing of data sharing agreements, data collection and reporting, and handling the myriad of logistical and administrative details needed to bring this into a seamless system where the beneficiary, that end user, that job seeker with and without disabilities gets truly the opportunity for not just a job, but a career pathway. So let's come back through these multiple 5 definitional areas of collective impact, and let me provide you with some ideas. Make it more practical. What can you do at a local level or at a state level? Harnessing the power of collaboration, common agenda. Recommendation number 1, state and local workforce boards can proactively outreach to people with disabilities and their families, providers of long-term services and supports who are serving people across the spectrum of disability, of working age, and disability nonprofit organizations to help identify needs and challenges to effective participation in the career and training services to be funded by the workforce development system. How might you do that? You could look at doing public forums. You could look at focus group meetings. You certainly, with draft parts of the plan, whether it's strategic or operational components of the plan, obviously bring people together and support them in terms of seeking formal and informal comments from their different perspectives. A second recommendation under this power of collaboration, common agenda, is you can identify across service delivery systems efforts to increase competitive integrated employment for youth and adults with disabilities. The proposed rules talks about several examples of where this might help develop a common agenda. Look at integrated resource teams, something that the Disability Employment Initiative, funded by ETA and ODEP within the Department of Labor, and now being played out in over 25 states. You have some examples of where multiple systems are working together, serving an individual one person at a time. It's also about braiding and blending of funding. How do we make this work? It's also about data sharing agreements. What about shared measurement systems? Recommendation number 3, look together at a local level and at a state level and look at customer flow. Develop a map of services and the touch points across systems for common customers who may benefit from multiple system service delivery. Ask for customer feedback on quality improvements needed for improved and enhanced coordinated service delivery. Review and reach agreement on common performance goals among systems. Disaggregate data, as Kim was talking about it, that reports on what's happening or what will be happening for job seekers with disabilities in terms of access to career and training services, to skills certification, and ultimately to employment outcomes. Recommendation number 4, describe the metrics the state will use to measure the strength and effectiveness of collaboration. So this is one of the performance goals, but it's really not fully defined yet. You have this great opportunity, multiple systems sitting down together to talk about how would we measure the strength and effectiveness of our collaboration efforts, and what kind of data would we collect. Some ideas might include increasing the number of individual plans for employment developed jointly by vocational rehabilitation and the workforce development system, increasing the percent of customers who benefit from braided or blended funding, or increasing the number of formal agreements between different service delivery systems that detail the collaborative process. How will John or Mary receive services, common customer, maybe in sequence, maybe within that same approach of an integrated resource team, identifying what will VR do, what will the workforce system do, what might Medicaid do in terms of long-term services and supports. It's looking at this in a very shared, responsible, systematic way. Recommendation number 5, document and describe the approach the state is taking to coordinate services with other disability service delivery systems. This is one of the new requirements in the Unified Plan development. MOUs, Memorandums of Understanding, be developed that describe how resources will be braided or blended. And it names specifically working with Social Security Ticket to Work program. It talks about specifically the mental health system, the system of service delivery to people with intellectual and developmental disabilities, obviously vocational rehabilitation. How will these different systems work with the Title I service delivery system within the American Job Centers and outside of it? Where will there be linkages? How will service delivery be coordinated? How will personnel and providers be cross-trained? And what data outcomes will be shared, and how will they be tracked? Recommendation 6, again related to mutually reinforcing activities. How can we identify state laws, regulations, and policies that today might be impeding successful achievement of workforce development goals and include strategies to change and/or modify them? Well, first we need to understand what are the barriers. Is it a legislative or legal in terms of a law, or is it something that came in regulation, or is it something in guidance, or is it the way we're implementing regulations? We need to seek public input on the challenges being faced by people with disabilities so that they can access services and supports they need with resources integrated across systems. As a group, we can collectively work on identifying policy and program changes, solutions to the barriers identified that will encourage braiding and blending of public funding to advance employment and economic self-sufficiency. Recommendation number 7, in terms of continuous communication, establish a standing work group of the state and local workforce development boards to identify barriers and facilitators to collective impact that benefits the employment and economic advancement of youth and adults with disabilities. Well, how might we do that? Encourage getting involved with Centers for Independent Living and other disability groups to present on challenges and opportunities. Produce regular reports to the workforce development boards. Appear before the workforce development boards on documenting progress in meeting collective goals. So there is not a mandatory requirement of these work groups, but it would be a great idea at the state and local level that there be a work group that really is focused on service delivery and employment and economic outcomes for people with disabilities. And finally, recommendation number 8 on backbone support. Dedicate time at each workforce development board meeting at a state and local level to review current status of core indicators of collective impact regarding employment and economic advancement for youth and adults with disabilities. So again, those core components. How are we doing with shared measurement? How are we doing with mutually reinforcing activities? Have we refined our common agenda? Have we developed our approach to continuous communication? We can look and analyze data, disaggregated data that's coming into the American Job Centers and being reported up through the states to the U.S. Department of Labor. We can invite other disability-related systems to present at Workforce Development Board meetings on a regular basis, and we can document success as well beyond the data. Think about at local and state Workforce Development Board meetings, formerly, as it says here, WIBs, Workforce Investment Board, now to be called Workforce Development Boards. Have personal stories, have individual presentations. What's working? Why is it working? How did the systems, the multiple service delivery systems, work together in terms of this whole approach to collective impact? We offer you some additional resources. There are quite a few. Some of those are from the LEAD Center and have been developed to help understand both Title I and Title IV, as well as now the proposed rules, the notice of proposed rulemaking, looking particularly at sections as they impact people with disabilities. We have the first archive webinar, which was the overview of WIOA from a disability perspective. This is on the LEAD Center website. We also urge you to take a look at USDOL, Workforce Investment Opportunity Act website, as well as the Advisory Committee on Increasing Competitive Integrated Employment for Individuals with Disabilities. There is a brand new set of materials from ETA. I really urge you to take a look at this. They're called Quick Start Action Planners. There's one on partnerships, state leadership and governance, service design, youth service strategies, and local leadership and governance. So we've shared a lot with you. We wanted to make this even more practical and granular. We've invited several leaders who are working already together here locally and in DC. Similar activities are going on across the country in terms of state agency directors working together. Thank you for being with us. Andrew Reese, Deputy Director, Rehab Services Administration, Andrew Rogers with the DC Workforce Investment Council, Deborah Carroll, Director of DC Department of Employment Services, and Paulette Francois, Deputy Director of Workforce, DC Department of Employment Services. Well, let me turn first to Andrew and just ask you, I know you're probably just beginning to get to the unified planning process, but I know you're already working quite a bit with the workforce development system here in DC. Maybe you can give an example or two of some of these new efforts at coordination and collaboration.
I'm assuming you mean Andrew Reese or Andrew Rogers, sorry.
Good. Andrew Reese, to start.
Okay.
Thank you.
Yes, and we actually, fortunately, started working together in July when WIOA first passed. We've been working very closely with the American Job Center partners to try and align our services. We have already, with the VR agency, prior to this, we didn't have the presence that we need to have at the American Job Centers. We had a VR counselor there at each of our centers once a week. Our plan, we have 4 centers in the district. Our plan is to have VR counselors there 5 days a week. We've already got that now in 2 of the centers, and we'll have it there as soon as they're able to work out our space and equipment needs and all of that. We should have all centers fully staffed soon. The other thing we've been doing is a lot of work with all the partners on coordination of, we've created a draft common intake form so that whichever agency you come into, we're collecting the same sort of basic data that all of us require, so that people don't have to be asked the same questions of each of the agencies, and working together on figuring out data sharing and accessing, having an interface between our systems so that we will be able to share data as we all work with some of the common people that we're serving here in the district. One of the really helpful things I have found through this process is that what we're learning is that we really are serving all the same people. And so, you know, we're serving the same people and confronting many of the same issues, and it really is becoming a much more efficient workforce development system and a more efficient process for working together to move all people to employment. And so, while there needs to be this focus on supporting people with disabilities, many of the same issues and the same barriers that people with disabilities face are the same barriers that other people in the district who are seeking employment face. And so we're working together to come up with solutions to those in the district, and the solutions are really no different for people with disabilities than they are for the other people we serve. And lastly, the most important piece of being able to share data, where our Office of the State Superintendent is collecting data about training programs, who's been in the particular programs, and we're working out a system where all of us will be able to have access to that, what's called a data vault.
Thank you, Andrew. I'm going to turn to the other Andrew and see if you have some other examples or want to amplify on, as you look at this new law unfolding, the improved coordination and collaboration to serve job seekers with disabilities.
And I hope that you all can hear me. I think that, you know, Andy pretty much hit the nail on the head with how he described what we're doing in the district. One of the things that I will definitely highlight, though, is as we're moving and doing the work, what are the areas that we're looking at is the career pathways. In May of last year, some legislation started working through our actual city council ahead of the WIOA legislation being passed. And you know, it kind of put a very strong emphasis on us working together as a system and coordinating the services that we need. One of the things that it did, though, the legislation that was drafted, is that it did not include disability services as one of the task force members for our Career Pathways Task Force. And so what we've done is we've gone back, we've highlighted that within the legislation, and we're trying to get it changed, but we've already invited the team from ZDS to be a part of that working group, so that way we can ensure that we are linking those career pathways, and that part of that discussion is how to ensure that individuals with disabilities are integrated into the full process. So that's one of the things that I definitely, you know, think is pertinent, is ensuring that there is that opportunity to connect them, to connect all individuals within the district to the system.
Thank you, Andrew. I'm going to turn next to Deborah Carroll, Director of DC Department of Employment Services. In listening to the presentation from Heather and from Kim and my recommendations in terms of collective impact, can you share with our wide listening audience some of the things that you're thinking about in DC in terms of coordinated planning and collaboration?
Well, hi, thanks for having me. The district and DOES in particular, along with our sister agencies, are working together to really build a system, which means that we're looking not only at what dollars we have available within our agency, but also looking at the significant investments the district has made in multiple agencies in terms of providing workforce services. What we're hoping to accomplish in that effort is really understanding how we can reduce duplication of services, leverage the talents of the multiple agencies that exist, particularly in human services, as they provide many of the support services that are required under WIOA, and then really focus the investments on the gaps that exist, including occupational skills training and some of the other services that may be required or where we may not have sufficient capacity. I think the second is transparency in the availability of slots and training slots and where they are and whether or not there's actual availability. We're working on developing what's called a data vault. Our Office of the State Superintendent has done a great job in, I don't like the word use pilot, but initially creating the first phase of the system by putting the adult basic education programs within the system. It also leverages and connects to the human services agencies at TANF and as well as the Department of Employment Services with the goal of essentially providing a menu for residents to select different training programs and services and connecting to them right away, essentially enrolling in them because you know that there's a slot available. Part of the complexity around WIOA and the integration is finding tools that you can essentially create very quickly that will allow for the exchange of data and traceability of where your clients are in the system. So part of that work is going to be designed through our strategic doing. We're engaging with a contractor through the Department of Labor to assist us with that. And really bringing all the partner agencies to the table to set up priorities, identify what assets we all bring to the table, and then determining what gaps need to be filled with the resources that we have.
Thank you, Deborah. Maybe I'll throw this next question now to who wants to go first. Maybe Paulette, we'll see. Of course, this whole system of unified planning also is covering youth, not just working age adults. Can you discuss a little bit of possibly some changes that may have already begun or you see in the future in terms of planning more coordinated, collaborative activities that engage youth with disabilities?
Yes, this is Paulette Francois from DOES. I guess as was stated in reference to the adult side of the house, we see the framework being very similar for youth. As we know, with WIOA, there are a number of things that have remained the same, but the spirit of the law speaks to collaboration and innovation. And what we are attempting to do, just as we're doing with the adult side of the house, is really looking at ways to leverage our partners and bringing our partners to the table to build a framework that's not just for the adult population, but for the youth population. And I'll just start with the in-school concept. We've talked about, as you know, the allotment and the allocation for the distribution of funds are different from when the WIOA program was in place. What we hope to do is to partner with our Department of Disabilities and to really work with them in terms of the in-school population and leverage our funds with their funds, kind of aligning our priorities and really zeroing on that population that needs that support. On the disconnected youth and the year-round side, what we hope to do is similar with our TANF population, working with our youth that are engaged in the criminal justice system, really looking at working with our adult ed partners and really building a system and not duplicating. Obviously, you know, it's very easy to put out an agreement that says we're going to find all 14 elements, but we have partners who already provide some of those services. We have organizations already providing many of the occupational skills training that we need for disconnected and older youth. So we're looking at a very similar framework and really using that same model to build out the way we design our services. Right now, the change in-house that we've made is to move our year-round youth program is now under the Workforce Development Department, to ensure that there's a seamless co-enrollment process with the older youth and the adult program. So we were looking at a continuum and a service delivery system that really is seamless, but way more integrated, and again, not just looking at the interests and needs of DOES as it relates to workforce, but ensuring that we build a system that meets the needs of all of our core stakeholders and partners.
I think, this is Deborah, the other key part of this is really institutionalizing the process of working with youth with disabilities into the fabric of our organization. And I think Andy Reese already mentioned some of the work that's happening in the American Job Centers, but it really is being much more focused and intentional on less program-specific services, but really tailoring the services around the needs of the individual. And being more inclusive in its programming as opposed to cherry picking and trying to, reach unrealistic outcomes, for example. And so, really the goal is to work much closer and have much more synergy amongst all of our various agencies that have youth with disabilities within them.
Absolutely.
And so, with that coordination, even if we identify someone that has not yet been identified by DDS, we want to make sure that there's a way that we can connect them to the services that they may be entitled to while they are engaged in workforce training and supports. And the goal would be to make sure that they have whatever supportive services that are needed through those partnerships.
Thank you, Deborah. Thank you, Paulette. Thank you, Andrew and Andrew. Just for this brief conversation, but I think you've really helped the audience with some of the very specific, practical, and very inclusive ideas that you've shared, and again, promoting in a more intentional way, a more inclusive way, services for youth and working age adults. I think you're off to a great start, and I know this kind of activity between VR and the workforce development system, the labor side generic agency, and other agencies is taking place all across the country. So thank you for sharing some of your work in progress. I'm going to turn back now to Kim and Heather at the Employment and Training Administration for some panel questions. The first is, how are WIOA plans different from the prior Workforce Investment Act plans, and how can programs, providers, and advocates for people with disabilities get more involved in the state planning process? Heather or Kim?
Sure, this is Heather. So the WIOA plans are different from the WIA plans in part because the unified part is required. The planning across multiple programs is the biggest change, and then the planning requirements then themselves become common across those programs. Not all of them, but many of them then become common planning requirements, so that it forces those programs to have to talk to each other to talk to each other about how they're going to jointly, at the very basic, like fill out a form to answer a question, but like more lofty, like what is really your coordinated strategy? What's your strategy for collaboration? So it forces that relationship to happen, whereas before it was more aspirational. In WIOA, it's really, we want it. It has to happen, and so we really expect it. And in terms of like the sorts of requirements that are in the law, in terms of what Congress wants to see in state plans, it's really about alignment. A lot of requirements around alignment, a lot of requirements around common strategy, a lot of requirements around joint operations. So that's really the biggest key difference as it forces that collaboration. In terms of who should be a part of the discussion, I think, Kim, do you have some perspectives to add on that?
Sure. Well, really, everybody should be part of the discussion. you know, these plans are not written overnight, and the way that multiple perspectives can be incorporated into a strategic plan is for multiple programs to be working together on a regular basis. I think, Michael, you were also asking in your question about how organizations that are not necessarily running a government program but that have a vested interest in making sure that programs are run well, how do they get involved? I think, you know, it's sort of a matter of being a good citizen. So for one, the regulations are open for public comment. All local and state plans are also shared with the public before they're submitted. And it's not just at the public comment period. I mean, being engaged in and participating in workforce development board meetings is one way to contribute to strategic planning, making sure that board members understand what the values of the community are and what people are looking for in how programs can be run is useful to the boards, and most boards look for that. And the composition of a board invites that, because the board is not just the program operators. In fact, program operators are really a small piece, a minority of the board itself. So I think engagement with the board, participation on the board, and participation in the planning process all along, including the public comment period, are all key features for how to participate in the planning process.
Thank you, both Heather and Kim. A question that's come in from our vast audience out there across the country is, are there specific tools a state is supposed to use to develop the economic and labor market information, or is each state able to determine what information to use on its own?
So there's not a specific, you know, format or form or tool that a state has to use when describing their labor market information and the economic landscape and the workforce landscape of their state. All state labor market information shops are really well prepared to do this kind of work and to inform the work of the board as it's doing its planning. And so those the states can rely on the data that the state LMI shops have access to and the analysis that they're able to do without worrying about like a prescriptive format or like specific data points that have to be included.
Okay, I think that's very helpful. We have another commenter who was very interested back with our conversation with our DC leaders, and we'll certainly get this information. Wanting from Andrew Rees shared that they're using a common intake form, both VR and the labor system, and we will definitely get that and make it a part of the materials that will be available from the Lead Center. Next question is about key elements for a state to consider in the design of a unified integrated program. So this is more on the operational side. And if, you know, I don't know, Heather or Kim, can you list out a few of those core system operational components?
Sure. And that will be spelled out in more detail in future things we release. But so just based on sort of what's in the statute, you know, key operational elements are, of course, the data systems. I think DC spoke well about that, how critical that was, the shared data systems and sharing data across systems. That's a very critical element to better understanding your common customers. Written policies about how you're going to operate together are critical elements, and several of you have brought that up as well. How you're going to jointly assess your progress is an important operational element. How you're going to know how well you're doing together, and having some common goals. And then, so it's really about the policies, it's about the systems, the data systems, and then it's about any sort of operational mechanisms that you can put in place, memorandum of understanding, to get a common understanding of how you're going to jointly do things.
Okay, I'm going to switch quickly to a next question, and this is certainly in the proposed rules and the statute, that at the state level, the state boards must establish objective criteria and procedures for local boards to use to certify the American Job Centers, particularly looking at criteria around effectiveness and ensuring equal opportunity for individuals with disabilities to benefit from one-stop services. Do you have some suggestions for states and also at the local level on how to approach measurement, or what might be some of the measures you think about as states become more engaged in this piece of planning?
Sure. So this is actually a topic that is addressed in detail in the regulation. So I would encourage everyone to take a look at both the regulatory text as well, and that's in Part 678, as well as the preamble to the regulation. So the preamble explains sort of what we're thinking and where we're particularly seeking comment. So I would want to emphasize that the Departments of Education and Labor did have specific thoughts about this, but I would want you to glean that specifically from the reg text and the preamble to the regulation to see the picture of our thinking there, and then also to make any comments on where you think that the final rule might need to be different.
And I'll keep moving ahead in the interest of time. Question asked about integrated resource teams as used in the Disability Employment Initiative. Who might be considered for involvement in IRTs? What systems and funders could this be described in a unified state plan?
That's a great question. So let me speak about integrated resource teams in general for a minute and what we've learned from the DEI. So I'm not talking about the regulation specifically right now. An integrated resource team, which is a really key feature of our Disability Employment Initiative, that team can include really any program that touches people with disabilities, and as you all know, that's a lot of programs. So it can include the Title I formula programs, whichever one is relevant, adult, dislocated worker, youth, employment service, of course, vocational rehabilitation might be relevant. It might be that the Disabled Veteran Outreach Program, which is run by our colleagues in VETS here at DOL, would be important to include on the integrated resource team. Also human service programs like TANF and the SNAP ENT program, or disability-specific services and resources, the resources that are available and can be leveraged from mental health or IDD program services, independent living. I mean, any program that's relevant for an individual. It might even be an ex-offender grant for one particular person. Probably someone on the integrated resource team should know how the work opportunity tax credit can be used, what kinds of transportation resources are available in the local area so that a person can get to work and to their appointments, how ticket to work can be used. I mean, there's no one right integrated resource team. The whole purpose of an integrated resource team is that it can adapt and provide services and funding specifically for the person that the team is convened for. So they're really powerful teams that a lot of our DEI grantees have exemplified. So looking to them for some best practices on our community of practice on Workforce 3.1 is a useful guide. To get back to the Unified State Plan, I mean, the Unified State Plan can be as specific as a state wants it to be after the requirements of the Unified State Plan have been met. So if a state wanted to be able to discuss in depth how they plan on using integrated resource teams, they certainly would have the flexibility within the state plan requirements to do that.
Thank you, Kim. And next question is, must a state and local workforce board have a standing committee that focuses on service delivery to individuals with disabilities?
They are not required to have a standing committee focused on individuals with disability, but they certainly, that is an option for them under the law. States have some, well, there's requirements around how the boards need to be be composed and sort of the required members. There's also a lot of ways they can structure the board and their sort of decision-making processes to get all the right input from stakeholders. So certainly these type of committees are one way to go about it, and we think they would be an effective mechanism to ensure that individuals with disabilities have their best interests represented. So that would, it's certainly something they can do. And I don't know, so I think the slide advanced, so I was trying to read the question again.
I can go back. There we go.
And
no.
Sorry.
I have to go further back.
Anyway, so yes, they can have standing committees, and we would encourage the state and local boards to consider how they can use standing committees for both individuals with disabilities as well as many other groups, like the One-Stop Partners and youth. There are youth standing committees that could be considered, which could also have a disability angle. So there are a lot of opportunities there to have committees that would advise boards on very specific issues of interest.
Great.
Yes,
I'm going to try, Heather, to get two more quick questions in before we run out of time. The next one is, again, about youth, and the regs talk about local programs who use assessment instruments that are valid and appropriate for the target population and provide reasonable accommodation in the assessment process for individuals with disabilities. Are there any options that you might recommend that could be considered in implementing this requirement?
So this is Kim. I can speak about some known best practices in assessment, and again, I'm not talking specifically about the regulation at this point, but just about good use of assessment. The Employment and Training Administration published guidance actually way back in 2007, but many of the principles shared then remain viable. If you're looking for it, it's called Training and Employment Notice 21-07. It basically was to publish and share a guide that was called Testing and Assessment, a guide to good practices for workforce investment professionals. So assessment is a broad word, and the guide gave an overview of the many different types of assessments that are out there and sort of walks through how each of them can be used, things like work and career readiness assessments, literacy assessments, ability assessments, achievement tests, and skills and competency type tests. That guidance gave some really good advice on the appropriate use of assessment tools and pointed out that people might need more than one kind of assessment, particularly to do a whole person assessment. Those whole person assessments are the best to be able to guide career and workforce decisions. So the guide that we issued back in 2007, but that stands the test of time, underscored that any assessment protocol that would recommend that the same battery of tests be used for every single individual is probably not the best approach to assessment. So that figuring out which assessments are most relevant to an individual is really a better way to go in order to achieve that whole person look and that whole person assessment. The guidance, had some other recommendations in it about state and local workforce boards and state workforce agencies seeking legal consultation when they're picking out and especially when they're purchasing assessments, because you'll want to be sure that assessments are valid and that they're measuring what they say that they measure, that they're reliable, that they sort of regularly produce the results that you would expect across different people, and that the assessments are non-discriminatory. And also, another important feature of just good use of assessments is that the states and local areas take the time to train personnel who would be using them about selecting which assessment and about effective use of assessment tools so that the tool can be used to its fullest ability. The guide itself is pretty in-depth, so I refer you to that guide. It includes chapters on ensuring that test-taking environment is suitable for all test takers and the importance of and how to provide reasonable accommodation in the assessment process. So people that are interested in the good use of assessment, I would just like to direct them to that guide, and that was Training and Employment Notice 21-07.
Thank you, Kim. I would just add to that is work in DEI in multiple states and also under the LEAD Center looks at a part of customized employment, which looks at alternative assessment processes both at an individual and group level in terms of discovery, and you can find some of that on the leadcenter.org website as well.
Yeah, thanks.
I am going to try to see if I can get one more question in. I think this will be the last one, and maybe a great one, because at the heart of WIOA and at the community level is a customer-centered system and a system of excellent customer service. Have some suggestions for all our listeners about critical elements of such a system for probably all who come to the AJCs, but particularly about individuals with disabilities.
Sure. So, you know, we mentioned earlier that in addition to publishing the draft rule, which does actually, particularly in the preamble language, speak to what a customer-centered system looks like, we've also issued some training and employment guidance letters. These are sub-regulatory guidance through which the department is able to share our perspective on the implementation of WIOA, which, as we mentioned, is something that we are that states can act now to do and not just wait for the final rule. One of those pieces of guidance that we put out was a vision for the workforce system. And while the Department of Labor is the one that published that, that represents the shared thinking of the Departments of Labor and Education. And that vision was published in Training and Employment Guidance Letter 19-14. We talk about, there's three sort of critical ingredients to the workforce system and excellent customer service let me just list them because I think they're important. One is that the needs of business and workers drive workforce solutions. Another is that American Job Centers provide excellent customer service to job seekers and employers and focus on continuous improvement. And the third is that the workforce system supports strong regional economies and plays an active role in community and workforce development. So that TEGL, the Training and Employment Guidance Letter, also elaborates on what excellent customer service looks like. And it says that one-stop centers and partners provide job seekers, which includes a whole range of people, including people with disabilities, with the skills and credentials necessary to secure and advance employment with family-sustaining wages. American Job Centers in this type of system would enable employers to easily identify and hire skilled workers and access other supports, including education and training for their current workforce. Rigorous evaluation is necessary to support continuous improvement, a continuous drive towards excellence in the American Job Centers so that we can identify which strategies work best for different populations and in different locations in the state, and so that states, local areas, and training providers can remain accountable for their performance. Lastly, I would emphasize, too, that integrated data and high-quality, reliable data is a really important ingredient of excellent customer service, that constant feedback loop, so that policymakers and employers and job seekers know what's going on and how the workforce system is performing. And it also can inform their decision-making when they're selecting the kinds of training that they want to move into and selecting training providers. So, you know, you asked if the elements are different for individuals with disabilities than for other customers of the system, and I would have to say, no, that we're not setting up a separate system for people with disabilities that would have different criteria. We laid out these principles in the guidance because we believe that they work for all people and people with a variety of barriers to employment, including people with disabilities. So the guidance itself and the preamble to the regulation sort of lay out some of our thinking on what excellent customer service looks like. And, you know, I should add, too, that none of them are, I don't think, revolutionary concepts or ones that we think that are foreign to the workforce system. A lot of states and local areas have been working really hard in at least some of these areas, if not all of these areas, for several years. The thing that's really wonderful about WIOA is that some of the best practices across the country have now been sort of baked into the statute and are now going to be a part sort of forevermore of our system and how the workforce system operates. But I definitely want to acknowledge right up front that, or rather, not at the end of the webinar, that some of the emphases that we're making about what excellent customer service looks like are things that a lot of professionals in the workforce system have been doing for a long time that we're really proud of as well, and that in particular have been highlighted in advance in the Disability Employment Initiative.
Thank you, Kim, and let me just close with several points. First is from commenters who've written in. Please don't forget about engagement of the education agencies at a state and local level in planning. Good point. Another wrote us that don't forget about employment networks and the Ticket to Work program in state planning, as well as local planning. Another good point. And then finally, some wrote in and said, wow, this is great how the agencies in DC are working together, VR and the Workforce Development System. Want to learn more about that, and we'll go to our presenters and learn more about it and try to share that with you on the Lead Center website. So let me just remind you that our next webinar, number 3 in this series, June 24th, WIOA Youth Services, and then the final one on September 24th on Section 188, the non-discrimination provisions. I can't say enough of my appreciation to Kim Vitelli and Heather Fleck for this presentation today, taking these questions, and our panel from Washington, D.C., showing it really is possible to work together across systems and continue to be, as you use the words, even more intentional in building inclusive systems that can produce collective impact. So thank you all. We had at our peak over 500 lines and people participating. Great webinar. Thank you for joining us. We'll hopefully be with you again on June 24th. Thank you, everyone, and have a great rest of the day. Bye-bye.